cell line derived from a Friedreich's patient. And here's a Western blot from that cell line. So this is the low level of frataxin protein found in that cell line. And then if you add this compound, BML-210, whose structure is shown there, you can see an increase in expression of frataxin protein at either 2.5 or 5 micromolar concentration. Another postdoc in the lab, Kai Jensen, set out to do med chem on this molecule, and he synthesized about 30 derivatives of the commercial product BML-210. And what he found was that this orthoamine was essential, but he found that the linker length between these two benzene rings was also critical for activity. And this molecule, 4B, was one of the best out of the collection of 30 or so HDAC inhibitors that he synthesized based on BML-210. In collaboration with Sue Perlman and her very willing patients at UCLA, we tested the activity of these molecules on primary lymphocytes for Friedreich's patients. And here's a typical result. We've done this experiment now in more than 30 individuals. And in every instance, we see that carrier individuals have their frataxin levels, this is mRNA levels, increased to nearly normal status, and patient levels are normally increased by this molecule 4B to at least that of carrier status. So we believe that this is a potential therapeutic for the human disease, since carriers who have 50% of normal frataxin levels are asymptomatic. Okay. But will this work in vivo? So to answer that question, we turned to Massimo Pandolfo and his collaborators in Brussels. Massimo has developed a frataxin knock-in mouse where he's inserted 230 GAA repeats into the first intron of the mouse frataxin gene. And this animal, when homozygous for this knock-in of 230 repeats, exhibits about 65% of normal frataxin mRNA and protein levels. However, this animal is relatively asymptomatic. We're hoping in the future we can turn to Mark Pook for assessment of beneficial properties of our molecules in his yak transgenic animals, which do develop symptoms. But that work is just at the beginning. However, we do have results from Miriam Rai and Massimo on the knock-in mouse. So anyway, the first question is, will our HDAC inhibitors cross the blood-brain barrier and increase acetylation in the brain of either a normal mouse or the knock-in mouse? The answer is yes, with this beautiful experiment from Miriam, where she looked at the level of acetylated histone H3 or total histone H3 in the brain of an animal that was injected with either vehicle or this compound 106. And clearly you can see increased histone acetylation in the mouse brain. Okay. Then the question is, can we increase frataxin mRNA levels by injection of this molecule into a mouse? So the protocol that they followed was subcutaneous injections at 150 mg per kg for 3 days, and then the mice were sacrificed 24 hours post last injection. The animals appeared normal on histological observation. Frataxin mRNA and protein were determined by standard methods, and the RNA was sent off to another set of collaborators at UCLA, Dan Geschwin and Giovanni Coppola, for global gene expression analysis by microarrays. Okay, so the first result is, yes, indeed, the levels of frataxin mRNA were increased in the brain, cerebellum, and heart of the knock-in mouse. But recall, this mouse has only about 65 to 70% of wild-type frataxin. But nonetheless, statistically, compound 106 increased that level of frataxin mRNA back to normal levels. And indeed, Miriam found by Western blot analysis that the level of frataxin protein was increased as well. Now, what about total gene expression? So the same experiment with compound 106 was done by microarray analysis, where Illumina microarrays that contain essentially all the genes in the human genome are deposited on glass slides. mRNA from either wild-type mice, the knock-in mouse, or wild-type or knock-in treated with compound 106 is then used to probe those microarrays, and a large catalog in changes in gene expression are noted. So the next set of few slides have an enormous amount of data, which I cannot go into in detail in a short talk. But suffice it to say that what we see, first of all, is that there are differences in the gene expression pattern between the knock-in mouse and the wild-type mouse. So we'll call that the Kiki effect, or the frataxin deficiency effect. There are also effects of the compound itself on both the wild-type and knock-in mouse. So those are compound effects. But the important question is, what did we do to the differences between the knock-in and wild-type mouse in the cerebellum and brain and heart between the treated knock-in mouse and a wild-type mouse? That's the important result. This heat map shows that what we did is we reversed about 70% or so, 70 to 80% of the differences between those two mice by the compound from the Kiki effect, that is the differences between the wild-type and Kiki mouse, back to normal. So we have restored the gene expression profile for the majority of genes that are affected by the downregulation of frataxin back to a normal level. That is, genes that were down in the knock-in mouse compared to the wild-type mouse, now increased back to normal level. Genes that were up, such as stress response genes or whatever, that were up in the Kiki mouse compared to the normal mouse, now go down. Wonderful result. Now, is this also true